Hello and welcome to Wellness on Wheels. We are presenting to you from the comfort of our home to represent the fact that we can bring you rehabilitation services to the comfort of your home and community. I'm Anissa Stanozak, your CEO, and I'm responsible for corporate vision and strategy. I create annual plans, validate budgets and revenue, and create organizational growth and expansion plans. I also sign off on the annual reports of the organization. I have 2 years of experience as a CEO for a previous company and will apply my past experiences towards growing Wellness on Wheels. I work with the board of directors, advisors, stakeholders, and investors, and I oversee human resources, the CFO, as well as the COO.
I'm Danielle Adams, and I am the COO. I am responsible for the day-to-day operations of the organization. I will ensure the execution of plans created and validated by the CEO. I am new to this position, however, I have 4 years of previous experience as a director of rehabilitation for a large PT company in Flagstaff, Arizona. I am directly responsible for home health, director of rehabilitation, PT, OT, speech clinicians, as well as their assistants for each.
And I'm Nikki Harris, the CFO, and I'm responsible for financial operations in relation to payables, receivables, expenses, and treasury. I also oversee the month closing and data for year-end annual reports. I have a master's in business administration, and I was previously a CPA. I oversee billing, fiscal management, administrative, and office management, which includes marketing and accounts payable.
Our business, Wellness on Wheels, is a mobile healthcare unit. We function as an outpatient model operating under Medicare Part B. We are a nonprofit organization and we all have equal share in the business. We currently operate in Navajo County, Arizona in the cities of Winslow, Holbrook, Snowflake, and Dilkin, and we bring care to medically underserved areas, which may include people who would be hindered due to location or socioeconomic status.
In terms of our organizational structure and work setting considerations, we will provide services on weekdays from 8 a.m. to 5 p.m. We will have a rotating schedule throughout the month. 1 week, we'll travel to Snowflake, week 2, Holbrook, week 3, Winslow, and week 4, Dilkin. The day-to-day services we provide will be based on patient need, however, certain clinicians will treat on the bus on different days. Therapists who are not scheduled on the bus will use those days to travel to home health patients, and they're responsible for creating and maintaining their own schedule. PT is on 4 days per week, OT is on 4 days per week, and speech is on 3 days per week. All with overlap of 2 disciplines per day, with Wednesdays being the 1 day per week all practitioners are on the bus. This was to keep patients with lack of transportation in mind. This way they can receive all disciplines in one visit if necessary. Some unique challenges that we had to consider include a smaller working space, space-saving equipment that is also durable since we will be a mobile clinic, safety considerations of having a mobile clinic and devices, and scheduling challenges to reach many patients and accommodate several clinicians on the bus. Our aim and goal of the organization includes several factors. Navajo County and other rural areas in Arizona contribute to the large number of homeless. Navajo County has 6,000 square miles of federally designated Indian reservations, and Native Americans make up 57% of those in poverty. 23% of those in Navajo County did not enroll in medical insurance. All of these factors led us to believe that there is a need for low to no cost therapy services. Our goal is to ultimately have the flexibility to treat patients with a variety of neuromuscular and musculoskeletal conditions who do not otherwise have access to appropriate health care. Another important goal is to have the sensitivity and cultural competence with regards to treating the unique patient population. Catering care uniquely to each individual patient is important because Native American populations are often overlooked. We must take into consideration the cultural differences of our largely Native American patient population. For example, we researched that in general, direct eye contact is sometimes considered rude, and there is often discomfort at being treated in close proximity, so it's necessary for us to create a trusting rapport with each patient individually. Our goal also is to hire with our patient population in mind to build trust and comfort within our region. For example, hiring highly qualified Native American clinicians when possible will be beneficial for our patient population.
Our mission is to be a mobile healthcare unit that provides outpatient physical therapy, occupational therapy, and speech therapy to medically underserved communities, those who have no health insurance, or those who would otherwise have no access to these services. Our mission is to put our patients and their families first by providing high quality, comprehensive, and compassionate care in the comfort of their community or home, remaining sensitive to personal circumstances and unique medical needs. As we know, it can be difficult for a lot of our patients to travel, so our services aim to help the patient focus their energy on healing without the worry of traveling to a clinic by delivering services according to a treatment plan developed by patients, family members, physicians, and our home health staff. Our vision is to be known as the provider of choice for the medically underserved for health and wellness. We seek to help people live their fullest physical lives by providing individualized therapy in the comfort of their community or home. As for our values, Wellness on Wheels values people, quality of care, community, and working interconnectedly and collaboratively as part of an interdisciplinary team.
For our financial plan, we will receive donations either privately or through a corporation and from grants. We will need initial funding from external sources to purchase necessary equipment and space. These funds may be raised by way of investors, donors, and volunteers. For example, CVS Health, MedPro, Nonprofit Risk Management Center, Office Depot and Office Max, and Volunteers in Medicine. Our income will be generated through our services provided and will be paid through third-party payers or by the patients themselves via a cash rate. We will charge $25 to $75 per visit, but this can change depending on their income level. If a patient feels they cannot afford our services, they have the option to complete a physical therapy fee waiver, which allows them to be seen up to 10 times without charge. As we grow as a company, we expect to add a CODA, a PTA, and an SLPA to our team, which will allow us to increase the amount of revenue that we earn. We will provide our services via a traveling modified super ambulance to 4 cities in Navajo County. Our bus will be a large investment, $654,000, that we plan on paying off in monthly installments over 15 years. Other large expenses include medical equipment and technology, and these costs will also be paid off over time and will account for some of our depreciation costs. Our employees will be compensated according to area averages, and they will also receive a monthly stipend to be put towards a healthcare insurance of their choice. In our first year, we are hoping to have a net income of $388,000, and with that net income, we will put it back into the business to maintain our space, time, and resources available to our patients via our nonprofit organization model. For marketing strategies, we plan to use active and passive marketing. We will provide local homeless shelters, churches, and community centers with flyers and other marketing materials, as well as having outreach events with free screening services, education about health and wellness, and a healthy cooking demonstration that attendees will enjoy at the conclusion of the class. Our bus will have advertising on the outside, so as we relocate, we will have passive advertising. We plan on advertising employment on various job websites, and to incentivize working for Wellness on Wheels, we will provide a loan repayment program. Our target market specifically looks at medically underserved individuals who can be described as those who need assistance with improving their health as a result of limited access to healthcare due to lack of health insurance and low income. An index of medical underservice of 60% or less qualifies for designation as a medically underserved area. Navajo County has an index of medical underservice of 38.1, and our target market includes Caucasians, which make up 47.9% of the population, followed by American Indian and Alaskan Natives at 44.2%. Seniors make up 16% of the population, and this market of Navajo County has an overall poverty rate of 29.07%. However, Native Americans and Alaskans fall even further below the poverty rate at 46.64%. Additionally, 41.17% of Navajo County's residents have less than a high school education, and their unemployment rates are high at 51.55% for females and 38.81% for males. For our competition, our research revealed 2 nonprofit centers in Navajo County. Winslow Indian Healthcare Center has locations in Winslow and Dilkin, and this facility provides behavioral, dental, health promotion, disease prevention, optometry, prenatal care, pharmacy, medication, physical therapy, and women's health. Summit Healthcare has a location in Holbrook, and this facility provides cancer care, cardiopulmonary rehabilitation, diagnostic imaging, dietary and nutrition, home health, inpatient dialysis, IV therapy, occupational therapy, pharmacy, surgical services, telehealth, women and infant services, and wound care.
For our SWOT analysis, our strengths include the fact that we require less resources than if we were a typical outpatient clinic, easily accessible care with driving to patients' home and community, and quality healthcare at affordable costs. We also are able to provide proper patient, family, and caregiver education with our business. Some weaknesses include that we may lack appropriate space for certain treatments, and marketing to our specific target population can be difficult. Some opportunities included with our business include the fact that we have the ability to train new graduates and international students, the growing population of 65 and older giving us an influx of patients to treat, and partnering with hospitals in surrounding areas in order to increase the referral rates for our business. Some threats to our business include the fact that financial conditions can be dangerous at startup, competitor treatment, such as providing treatment via modalities that are not equipped for the bus, and the inability to provide aquatic therapy can be a challenge for us, and also that the shortage of skilled workforce wanting to provide care in a medically underserved area.
So you may be asking yourselves, why choose us? Wellness on Wheels has a unique advantage over our competition. We are able to provide multidisciplinary rehabilitation services, including physical therapy, occupational therapy, and speech therapy to those living in rural areas. None of our competitors have all three disciplines at their disposal. We are able to provide patients with a one-stop shop for their rehabilitative needs. This prevents patients from having to travel to numerous locations to receive therapy. Our competitors' services are widespread, which may result in less specialized care. Lastly, Wellness on Wheels is focused on bringing care to the medically underserved, especially those who are homeless. Although our competitors are both nonprofit organizations, ours caters to and specifically seeks out the homeless who are also in need of care. So that concludes our business plan. Thank you for your time and attention, and remember,
Wellness on Wheels can make you really healthy.